Okay. So yeah, hello everybody. My name is Umesh Suhail and my topic is asthma in children. So today we'll see the introduction of asthma and its sign and symptom and its causes of the asthma. So we start with the introduction. So asthma is a chronic inflammatory disease in the lungs, which is mostly common in the children, and sometimes it's very mild and but sometimes it's fatal inflammatory disease of the lungs, and this is characterized by the shortness of breath, wheezing, and tightness in the chest muscles and coughing. So, like these are the very common causes: allergen, dust, mite, waste from the cockroaches and mice, and the other triggering factors are cold air and tobacco, smoke, and infection. So, yeah, this is a very good example of the normal lung and the asthmatic lung. You can see the normal lung muscles are very relaxed, and the linings are also normal. There is no excessive secretion of the mucus. If you compare with the asthmatic lung, you can see the tightness in the chest muscles, as well as there is a inflammation in the lining inner wall of the chest, and there is excessive secretion of mucus. Because of this swelling and excessive secretion of the mucus, there is a restriction in the airway. Yeah, and so now significance of my research topic is that, so I just have to, the significance that is that corticosteroids inhaler for children are more crucial mode of the treatment for the asthma, and because the steroid has a tendency to suppress the inflammation of the wall that we have seen in that diagram, but chronic and the long-term use of this corticosteroid may lead to cause some drawback like a fracture and reduction of the growth height and respiratory infection as well as the diabetes. So this is the diagram. You can see what are the disadvantages of using long-term corticosteroids may lead to cause diabetes, respiratory infection, reduction in the height, and osteoporosis, which may lead to fracture and eye problem also, and there is some problem in the adrenal hormone like hypothalamic pituitary adrenal axis suppression. So I just find out some supportive article for the vitamin D supplement for children, which may reduce the osteoporotic activity, may lead to reduction in the fracture level in the children. And one more supportive article is the respirometry exercise for the children with the asthma, which may strengthen the chest wall muscles, which will support the while inhalation and exhalation. Yeah, and these are the basic questions which can be asked in the article, like what are the pathomechanism, what are the causes of asthma, and what are the side effects of steroids for long term, and type of study, method of using study, and all. So the background of my research is that the aim of study was to conduct long-term use of corticosteroids and its drawback in the health individual child who is suffering from the asthma. So they have used the methodology, like they initially did a lot of research and different mode of information platforms such as Midline and InBase and other is PubMed to differentiate and do comparison on many studies on asthma. They selected the controlled observation study to inhale corticosteroid used in patients with asthma. They conducted random effect meta-analysis of a mean difference in final height and between the groups. So they have selected two groups, like a control group and one is a normal group. So they have to one group they have given the corticosteroids, and other group they have given just the placebo effect. That was just a normal saline water, to check the differentiation. So that after the result, they just found out that there was a significant reduction in the growth of children after 1 year follow-up. They find out 23 relevant study after screening. There was evidence of final adult height show a mean reduction between 1.90 centimeter to 0.50 centimeter. So there was a reduction in height compared to the normal one. And the conclusion was that use of steroids for long term for 12 months and more, which in asthma has a limited impact on annual growth velocity. And so there is a slight reduction of about a centimeter in final adult height, that is 0.7% compared to known who is not using the that corticosteroids. We have given them the placebo effect. So what are the bulk of script? So this is application of research on real world that help people to understand an issue and get evidence based on treatment of particular disease or condition. Impact of research is that it has better understanding on the velocity and person learning, so to spread the awareness and to prevent the future complications. Thank you so much.